For a while I've thought to myself, now when I'm talking to people about Victoria, how should I talk about her? What should I call her in terms of what she does, and how would I explain it? So I thought, I'll just ask Victoria, what do you call yourself and what do you do?
Thank you, Fiona. You'd think this would be a simple question. What I have done is specialised really deeply in sexual recovery and sexual rehab specific to prostate cancer. So what I call myself is a sexual recovery specialist for prostate cancer.
That's easy.
And it's come from a background that's included a degree in psychology, a master's in cognitive psychology with an emphasis on behaviour change for health behaviours. And then I moved into sexology and a lot of short courses in there, including counselling and sexual rehab specific to prostate cancer through Movember's True North project. I've also been doing my PhD for up to 4 years now, specifically looking at how we can better deliver all the solutions and options and ideas and practical ideas specifically for prostate cancer. Then on top of that, I also realised that the exact course that I want to do in order to be able to essentially be somebody's sort of account manager for their sexual journey, for me didn't exactly exist. So I co-founded the sexuality design course at RMIT University with Dr. Judith Glover, and that was in 2015. And so through that we looked at sexuality and a sexual journey through a design lens, so including products that can help, services that can help, what problems people really had to do with sexuality, and always going back to the literature and always staying evidence-based. But my focus really is on the practicality. It's what I want to see is that every couple, even before they have any kind of treatment, really know what's going to happen, why it might happen, what to do. If it happens, all of their options, they can go in with a lot of hope, not feeling anxious, feeling confident that whatever happens, there's something they can do. And so, well, that was the short answer.
That's a good one.
Yes, it is a good one. So, more specific then, I suppose, is who specifically can your services assist?
Great question, Fiona. So, I love working with either men who are going on this sexual rehab journey alone, or couples who are going on it together, or a partnership where they want the sex recovery, their sexuality to be separate from sexual rehab, but they want to do that together in some ways, but apart in some ways as well. So that's the thing, even within prostate cancer, there is no set script, there's no one size fits all. No. It's if you are going through a prostate cancer journey, that you can come to me, whether that's alone or with partnership, or hell, with more people if you want, whoever's on this journey with you.
Wow.
And then we will, organise based on sexual values, how you want things to be, what your particular goals are, what you want to achieve, a plan and a map that will suit you.
It's sort of a transition into a new normal, isn't it? Because it's a 180, completely flips people. And I think as part of your research and the work you do with couples, is the whole relationship has to be renegotiated in some respects.
Absolutely.
If they want to, of course. That's the trick.
Yeah.
That's
great, Alan. That's that. Look, at a very high level, everyone who's gone through this has moved into a new reality, a new world in some form.
Yep.
Yes.
And that can't be underestimated. Look, even if someone comes out the other side and the erection's still there, they can't ejaculate. And for a lot of people,
that's
confronting. And again, that makes everything about sexuality potentially very different. And it's embracing that rather than trying to go back to what you had, going, right, let's embrace that, there's been a change, this is life, change can happen very suddenly.
Always change.
There's change, but within change there is a lot of opportunity, so long as you do know what's happening, why it's happening, what your options are. And then from that point, it's all agency.
Yes.
I don't necessarily even really do a hand-holding approach. I want to put as much agency back to, especially not, I definitely don't come home with you and hold your hand physically the whole way. I do not,
shout instructions from the bedside.
Yes, and it's a good thing to mention. I've had clients before ring up and say, gosh, she's not going to ask me to take my clothes off, is she? And my practice manager said, no, the room is set to a perfect degree, please keep your clothes on. I think her insurer especially needs you to keep your clothes on.
Yes.
If we're just having a really good conversation. It's sort of, you saw a financial planner because you wanted a really good overview on your finances and your goals to do with that and what to do next.
That's a very
But
good
for
way
your
of putting it, I
sexuality.
think.
Yes.
Because I was going to say it would be, I presume, potentially quite uncomfortable and a little embarrassing and awkward when someone walks in to see you for the first time. So how do you find, when someone comes for the first time, do you have a little routine to sort of put people at ease, or do you find that by the time they've summoned up the courage to come and see you, they're usually quite calm, or what's the usual?
Well, here's the interesting thing, a principle I've noticed through all the different types of work I've done within sexuality is the more comfortable and confident I am talking about sex, and at this point in time, I'm extremely comfortable, the person in front of me will take that on.
Yes.
And so what usually happens is men and their partners, the partnership will come in and absolutely, Fiona, of course they're feeling at first very uncomfortable and unsure. This isn't a usual situation.
No.
It's new. And so because it's new, the body physiologically reacts to that novelty and,
Yes.
can bring on a bit of an anxious response. So what I'll try to do is just create an atmosphere that's totally comfortable. And then often it's usually around sort of 15 minutes to 20 minutes in when we're just casually talking about sexuality and, what they want their sex life
Yes.
to look like and how it was. And one of them just suddenly goes, oh my goodness, we're talking about sex. Isn't this usually uncomfortable and awkward? And that's wonderful. It's good to speak that out loud and to talk about, yes, isn't that interesting how while it's something we all do, we're more used to talking about the weather
Yes.
than sex and sexuality, even though it's actually something we've all got in common.
Exactly. We are sexual beings, and our sex can be very out there, it can be very low key. There's a whole variety, as you would well know. So I think it's great that people have the opportunity to come and see you. When someone comes in and they have a conversation with you and you sort out their goals, or they help describe their goals and you help describe what approach might help them best, is there typically any number of sessions that you feel are most beneficial for people to get to where they want to be?
It's a good question. So look, sometimes just having that one consultation, and it usually goes over a little over an hour. I say just so people can map out their days, expect between an hour to actually an hour and a half, so you can sort out your parking, because I want to make sure people leave the room really with what they needed. And so sometimes what someone needs is that full explanation and simple education. Look, this is what's going on with your body, so this is why certain things are happening and certain things aren't happening. And if somebody's just needed that and that's helped them just set off on their journey, that's fantastic. When it's the case that sort of almost a homework is given because they've heard of a new approach during the appointment, they've gone, yes, I know that's the one for me. I want to give that a really good go. We all know from behaviour change of any kind that some accountability and the chance to reflect on what's working, what's not, and then tweaking is so important. So for that situation, I do suggest that come back in maybe 4 weeks or 8 weeks. Again, that then comes down to their lifestyle. I always want to make sure I understand what a person's life looks like so it can be realistic. If somebody's going to be travelling a lot for work over 4 weeks, it's going, okay, well, just try this once a week and then I'll see you in 8 weeks.
Yes.
So we've got enough time. But that's the thing, it really does vary. I make sure that everything is tailored to the person, and I also want to acknowledge when something is beyond my expertise. So if a couple comes in and what we identify in the session is there's been a build-up over years of potentially a lack and a deficit of intimacy. What they're wanting really to do is to fill up that tank again, then actually a couples or a sex therapist probably is more appropriate for that. But in that session I would explain, here's how you go about that. I can recommend the couples therapists in your area who I know have experience with prostate cancer, so that they have an easier journey into that world.
And communication's important, and I think for couples, most couples that we've come across, have been in a relationship for some time. And I think for most couples, I find the communication starts to get a bit slack. There's maybe not as much effort being put into it, unless it's maybe like we are in a second relationship. So there's possibly some more effort, maybe. And for some couples in their 60s, sex may no be longer that important.
Yeah.
but they wanting to find another way of being intimate. So
Yes.
coming to you helps to look at other ways, which is
Yes.
important. They don't have to do it that way.
Mm.
But again, it's a bit, they've been completely flipped in their relationship
Yes.
and don't know where to go next. You may read some books, but not relevant to them.
Yeah.
And it is a whole new ball game. So where do you go?
Yeah.
It's the important thing that couples are told that your support services are here.
Mm.
And if they don't know, then they just keep doing what they've been doing, or they may just let the whole thing slide, which is, to me, disappointing. And again, it's what every couple wants. I get that, but I think, well, you know, you've been flipped over, here's some change. You can maybe make your relationship even better now.
Yes.
Make changes, whatever it may be for you. So
Yeah.
the whole purpose is to make sure that they're aware of these services
Mm.
and make use of them. And if it works for you, if it works, that's great. If it's not what you want, that's okay.
Yeah.
But at least be aware you can seek help
There
or
is
seek
something you can
assistance.
do.
That's the point.
Yeah.
And it is true that you also offer services via Skype, I think.
Oh yes,
Yeah.
thank you, Fiona. And to build on, and that's to build on that point, Alan. I'm particularly obsessed that people just know what options are available
Yeah.
and to make those options easy.
Yes.
So that was, I think, what drove me into doing the PhD research, was just interviewing men and their partners through doing this course I put together at RMIT. Really realising often they felt their options were pills, injections, or sex shop, sex therapy.
Yep.
And all of those might have been either too confronting, not easy enough to get into, and it's also not the reality that those are the only options.
Yes.
And so I really wanted to find ways of how can we, for example, get the same quality information, evidence-based research translated to men who may be out in the country on a farm, but they have Wi-Fi.
Yes.
Yes.
So I offer Skype. I also occasionally do webinars, as you two well
Yes.
know. My talent, my stars. And I'm also now offering an online course that's email delivered. So again, it just keeps everything front of mind and gives you new ideas. But you know, during the week rather than all at the same time, so you don't get information overload. And I've got lots of future plans on how to use the internet more than just these YouTube videos.
Yes.
So encouraged to do them by the feedback that comes back from people who are not near enough to services.